Hello, and welcome to the American Red Cross CAN Tools Overview and Highlights presentation. What are the CAN tools? CAN includes information sharing tools to increase the coordination of services that help clients move through the recovery process. CAN provides a participation framework for vetted recovery partners to share information, a single case record for real-time collaboration to more effectively meet client needs, extended information sharing fields specific to long-term recovery group and disaster case management program needs. CAN tools are automatically made available when the Red Cross Level 5 or higher disaster relief operations are activated, when a federally funded disaster case management program grant award is announced, or by division request as approved by the Executive Director of Recovery Operations. How do agencies gain access? Agencies must first register with their local Red Cross representatives to gain authorization to participate in CAN tools. Each disaster relief operation has a Red Cross point of contact. The agency must designate their own point of contact who will monitor and ensure proper agency use and approval of all user accounts. Red Cross regional representatives assist agencies registering for CAN by providing an overview of CAN tools, countersigning, authorizing the agency's participation agreement, coordinating with the disaster relief operations, and assisting agencies with questions, resolving issues, or partner collaboration. Red Cross National Headquarters supports regions by receiving the approved agencies for activation into CAN, identifying and confirming CAN tool leads on disaster relief operations, ensuring the agency understands their role and responsibility of documenting and storing all caseworker and client confidentiality agreements, and ensuring that agencies registering for CAN are trained on its use. Also facilitate regular CAN tools operation coordination calls to help resolve issues for all to understand. Red Cross establishes a baseline for client data by starting with the initial intake process, assessing needs, all the way to the first phase of recovery planning. Once this information is collected and recorded, the client's case may be handled by a long-term recovery group or disaster case management program, where additional access to resources and referrals will help the client move through the recovery process. New CAN users may want to review the YouTube web presentation, Your CAS and CAN Tools Accounts, for an overview after receiving access to the database. What is the role of the agency point of contact? Agencies new to CAN should appoint a single point of contact that will serve in the following role: authorizing access to CAN through their agency, ensuring proper training and orientation is provided to all staff, especially case managers accessing the database, ensuring the agency has at least one person designated to manage and compile data needed for required reports for the agency, and maintaining the agency's resource database and updating it as needed. Agencies authorized to manage client data in CAN add resources for the client referrals in the resource database. All resources offered are recorded in the client registry and may be exported for use by other agencies needing referrals. The client registry database provides a standardized format for authorized agencies to create a client's case record. This provides consistent case management across agencies, which complies with state and local reporting guidelines. The client registry offers real-time access to data and is integrated with the American Red Cross Client Assistance System for sharing in CAN. The Coordinated Assistance Network was designed to provide access by authorized agencies conducting casework for clients of a disaster. Access is granted only to those agencies with users with a direct relationship to the client via a signed, recorded release document. Any use that does not adhere to the posted CAN guidelines will result in immediate suspension of the agency's access. The client registry is composed of 9 tabs documenting the process for creating client data in the system. These tabs allow the caseworker to document client information in an orderly format. However, easy navigation back and forth is possible to record information as it is received or to update information initially entered. There are designated minimum information that must be entered in the system, such as the name, date of birth, pre- and post-disaster address, and other pertinent information highlighted with a red asterisk. Client consent must always be documented and recorded in the case client record. The client registry is laid out to record required fields and additional information received during the client intake and all other client interaction by the caseworker. Required fields are noted by a red asterisk in order to save all information gathered. Basic information about the client intake process is entered in the system in the Client Info tab to record household data such as number of members, pre- and post-disaster address, family members living in the household, and any other pertinent information. The Intake tab records the household demographics collected by the caseworker, especially how the client was impacted by the disaster. Disaster needs are formatted to comply with FEMA and DCMP reporting, covering most common client needs, and helps the agency to track needs over time. The Disaster Client Management Information tab, or DCM tab, helps the authorized agency to meet the reporting needs required by the governing agency and tracks the number of signed releases, case status, case managers involved, and the priority of the case that has been assigned by the agency. The Housing tab documents pre- and post-disaster address of the client, shows any reported damage assessment information about the residence if available at the time of intake, current condition of the residence, and information about client relationship to the residence. The Contacts tab documents in a narrative format all responsible persons or entities related to the client that must be informed regarding the resources available to the client. This includes advocates who may inform your agency of specific needs of their clients and identified needs that may be referred to an agency for client recovery. The Repair and Rebuild tab documents any repairs or construction needed for the client residence, such as mold remediation, cleanup, muck out and gut out services, building materials, and contractor estimates for repair. The Recovery Resources tab documents the long-term recovery needs of the client and records interaction or application to long-term recovery groups, FEMA, Small Business Administration, or other sources of assistance available to the client. The Recovery Plan tab is a working, living document of all interaction with the client to assist in making a recovery plan. This tab should be updated with each interaction with the client or advocate to document the client's progression to recovery after the disaster. Please note, this process can span days, months, and years depending on how the client was affected by the disaster. The Case Closure tab documents the end of the case management process for the assigned agency. Caseworkers must document why and when the case was closed, report on any unmet needs addressed by the clients, and their progression towards obtaining permanent housing after the disaster. Agencies accessing CAN to conduct client casework can use the Export Wizard to download data for reporting needs to regulatory agencies or disaster case management programs to show their progress in client case management for a particular disaster event. Reports can be created using selected criteria to meet the organization's needs for reporting. Please note, CAN should not be considered or used as the agency's only source for reporting data to regulatory or granting agencies. The Resource Directory provides information on local and regional resources for client assistance. This database shows all information collected for local referrals to agencies that may assist in meeting unmet client needs. Agencies accessing the directory should note that data is not maintained or updated by one specific agency, and that all resources should be confirmed before referrals are given. Here's an example of how the resource directory can be used to meet the immediate needs of a client through an agency such as the Salvation Army. Again, all referrals and service given to assist the client should be noted in the case record. Agencies found in the resource directory will have basic information such as the mission, goals, contact, and location of the agency for for caseworker use. Other details, such as services or assistance provided, may be included, but it is recommended that all agency caseworkers confirm information before using the resource for the client recovery. The program profile in the resource directory helps agencies organize related resources by geographic location, lines of service, agency location, delivery channels, and categories of need. The service profile assists caseworkers in documenting service type, eligibility, referral, and contacts for each resource in the system. The Coordinated Assistance Network provides disaster clients with a seamless transition between agencies and resources without reliving the disaster over again. Agencies coordinate services between each other and prioritize resources to the most vulnerable clients in the community without duplicating services. For more information on how to create, update, and manage your area's resource directory, visit the Training Resources tab in CAN.